a glimpse into the future. So Sam and I, he's a PTA director at South Arkansas, and we went to this really cool conference about how to use technology to help people learn. And I've been thinking about these choose your own adventure experiences when I was a kid. Any of you remember these books? It kind of made me chuckle to think about how much I enjoyed having some interaction with this. So I thought to myself, man, that would be kind of cool if I could build simulations. And I'll just give you a glimpse of this simulation here. Just this week, myself and a group of students and one of our professors kind of sat through and said, is this the way we want our students to learn? Will this help? So you can imagine at the end of shoulder week, I'll tell the students, guys, I need you to go play these 3 simulations that are in PhysioU for you. So they'll go in and they'll say, oh, this is a 50-year-old teacher with severe shoulder pain. Oh, based on her 8 out of 10 pain, her difficulty sleeping, it's waking her up at night. What is her irritability? So something as simple as that, right? So when they choose, I'm going to take you into the simulation. Let's see. So here's the simulation. I'm going to go all the way back to the beginning. And the students are essentially playing this through. So I'm going to go to test here. So as you are going through, you're like, oh, here's more information. She's having a hard time sleeping at night. She can't write on the board. She's a teacher. I think she has really high irritability. So here's a little recap. I think she has high irritability. So based on her irritability, what do you think is some of your top management strategies? Should you be strengthening her? Should you be doing range of motion? Should you teach her how to do functional movements, or should you manage pain and swelling? So the students will be able to begin to make some decisions that will be captured at the end. They'll be able to see what decisions they made right or wrong. And then here's some past medical history. She's dislocated her shoulder before. Should you refer her out? Should you proceed with caution? She's in a lot of pain. I'm going to proceed with caution. All right, so let's take a recap. Here's what we know so far. These are the things she's having problems with. And so there was the recap. Let's move on to the objective exam. So we thought, how do we make this playable and yet not so laborious? Do we really want the students to spend 30 minutes per simulation? No, I want them to begin to look at findings, begin to get a sense of what special tests were relevant, and notice that, range of motion is very limited for this patient. But their strength is actually pretty good, even though it's painful. So maybe this patient is a mobility deficit more than a muscle power deficit. So as you move through the simulation, we will ask them questions. So here's a summary of some of your findings. So I'm going to narrow things down for you a little bit, and I'm going to ask you to make some decisions. What would you like to do for her? But before you treat her, you do a pre-treatment reassessment. Oh, her pain's 8 out of 10 right now. It's still really painful when you assess her overhead reach. So it invites the student to get used to this idea that after my objective exam, I always do a reassessment, and now I apply a treatment. Notice how the treatments are very, very simple. So I have chosen to make these cases a foundational tool for pulling some things together that they learned in class. It is not complex because I can build more complex cases later. Because I really think students need a graded pathway to developing their clinical reasoning. They can't have too many crazy things to worry about. Oh, this patient might have cancer. Oh, this patient might have a nerve involvement of their problem. I don't need to do that. I just want them to say, hey, when the person's stiff, you probably should mobilize it. But irritability is always a key thing to consider. And so they say, well, I think we need to do pain and inflammation management. And I'm going to use a gentle grade 1 MOB of the shoulder, not some type of wall slide or an aggressive grade 3 mob or an end range stretch. I'm going to do something more gentle. And here's my home program. So I'm going to send her home with pendulums. Great. The patient said that felt great. Now, if you did it wrong, you get a picture of her grimacing and complaining that her pain was way worse. So I hope that tickles your mind a little bit. Because then after I met with the students this week, they said, could we do it like day 2 treatment, the stuff that we never get to? Perfect. So right now we are building day 2. Patient comes back. What would you like to reassess? Patient's pain is a lot worse. What would you like to do now based on what the order was from the physical therapist, which was stretching and pulleys? What would you like to do? Oh, maybe we could use some pulsed ultrasound to calm it down. Maybe we could use ICE and IFC to calm it down, right? So if you can think about how many ways we can begin to solve some of these learning problems for the students, PhysioU is dreaming and building these kind of things because they're hard to solve these problems with our time limitations as well as our really, as faculty, our own energy limitations. So in summary, I would just say that we're working with multiple universities. We are so excited to partner with you as you are using the apps. If you see things that you need or you have ideas, we are in build mode. We are continuing to dream of things to build. And you can see in the timeline, so we started this, 6 years ago. We are really about very close. I mean, it takes you longer than you think to film, edit, and build content for the apps. But a therapeutic exercise app is coming. The developmental milestones is coming. PNF is pretty much ready. We did this with Kaiser Vallejo, one of their faculty. So we have a slew of new apps that are coming. But, use already what we have to augment your classroom. And finally, the students, faculty always ask, how much does this cost to our students? They're already so overburdened. First, I would say we're very aware of that. So the students pay $54 per year. They get it half off, essentially. They can get 4 years for the price of 3, or in the case of the PTA program, 3 years for the price of 2. All of you faculty have full faculty access, so make sure you go onto PhysioU.com to log in and try it out. And if you want to direct the students to get it, the simplest way to get it is just to take them to PhysioU, show them, click on student, click on buy now, and they will be able to enter their email and get the 40% off student rate.